Hi, I'm Dr. Diana Kersten. In this video, we'll talk about what you can expect before and during your eye surgery. We encourage you also to watch our separate video on what to expect after surgery, which includes what limitations in your activity you should observe and what rare early warning signs of trouble you should report to us right away. There's a lot of information here, so you may want to take notes and watch this video more than once. 1 or more weeks before some surgeries, like cataract surgery, you may have a preoperative visit to our office to perform measurements on your eyes. If you wear soft contact lenses, please leave them out at least 7 days before these measurements. For gas permeable or hard contacts, leave them out for at least 14 days before the measurements. This will make the measurements more accurate. You can put your contacts back in after the measurements and wear them anytime up until 24 hours before surgery. 2 or 3 days before surgery, one of our staff will be calling to let you know exactly what time to be at the surgery center on the day of your procedure. That call is also the perfect time to ask any last-minute questions you may have. We recommend watching this video again around that time so that all this information is fresh in your mind. For some procedures, we recommend starting the eye drops a few days before surgery, so be sure to fill your prescriptions in advance. Check your preoperative instructions to see if your procedure requires drops before surgery. Even if you're experienced in taking eye drops, we also recommend watching our 3-minute video on our website on how to take eye drops. You're sure to learn some tips that you'll use. If you normally take glaucoma drops, you can continue these as well right up to and including the day of surgery. You'll also continue these after surgery without interruption. If you take blood thinners, for cataract surgery it's not necessary to stop taking them, but for other procedures such as eyelid surgery, our doctors may make specific recommendations for discontinuing these medications. See your preoperative instruction pages to find out what you should do before your procedure. If you wear any type of contact lenses, please leave them out for at least 24 hours before your surgery. On the morning of surgery, do not eat anything for about 6 hours before your procedure and don't drink anything for 4 hours before surgery. You can take your usual medication with small sips of water, except diabetic medications and water pills or diuretics. With diabetic medicines and diuretics, please bring these medications with you to take right after your surgery. Please leave all jewelry and other valuables at home and don't wear any makeup on the day of surgery. Please wear comfortable clothing. A short-sleeved button-down shirt or other loose-fitting shirt makes it easier for us to monitor your heart and your blood pressure. We perform most procedures in our state-of-the-art Medicare-certified surgery center rather than at a hospital. You should plan on being there for a total of about 1.5 to 2 hours. When you arrive, our nurses will help you onto a gurney and you'll be wearing your own clothing throughout the procedure. We will give you an IV medication to really relax your nerves, and the nurses will be putting a number of eye drops in to prepare your eyes for this surgery. You may or may not fall asleep, but we will absolutely make certain that you're comfortable and not nervous as you move into the procedure room. Most eye procedures take less than 20 minutes and are painless. If you're awake, you may see a bright but not uncomfortable light. Many people see moving colors like a kaleidoscope, and you may be awake enough to talk with us or tell us how you're doing. If you're particularly nervous or uncomfortable, we want you to tell us, and we will make you more comfortable. Otherwise, it's best to remain quiet and relaxed. After the procedure, you'll be on your way to our recovery area, where we will slowly help you up. Shortly after that, we will help you out to your car, and you'll be on your way home with the person driving you. Everyone who's having surgery needs a driver to get home. The best choice is a friend or a relative. Unfortunately, taxis are not allowed for transportation home. If you need help finding a ride, let your surgical counselor know. We hope this information is useful to you as you prepare for surgery. To learn what you should and shouldn't do after eye surgery, please watch our next video on this topic. Meanwhile, if you have any questions, please feel free to ask our staff. I'm Dr. Diana Kersten. Thank you very much for watching this video.